My name is Dr. A with Angels Core Care, and I'm a physician who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to enrich how you feel about yourself and improve your quality of life. I would like to welcome you to this program, and if you're here live, thank you so much for taking the time out of your day to join us. Please type hi in the comments so that we know that you're here. If you're watching the replay, we appreciate you coming back later and would love for you to type replay in the comments. That way we can know that you came to visit us, and we appreciate that. Also, if you have a question, feel free to type it in the comments, and we will answer all the comments and the questions that are listed. So, my topic today is a continuation of what I spoke about a week ago, which is opiate use disorder. And in particular, who gets opiate use disorder and how can you tell if somebody has opiate use disorder? As I mentioned last week, this topic may not seem to affect you, but maybe it does. It may affect somebody you know and you simply don't know about that. But according to the CDC, overdose deaths accelerated during the COVID-19 pandemic, and the COVID-19 pandemic is fueling the opioid crisis. Thus, this is a very real problem. So, if you have this disorder, you're not alone. And it doesn't mean that you're a bad person or lack willpower. It simply means you have this condition, but there's a potential for very bad outcomes. And that's why we really want to do something about it. Now, I first got introduced to opiate use disorder several years ago when I had a colleague physician who was taking care of patients with opiate use disorder. And at that point, I wasn't interested in doing this. And then I had one of my very own family medicine patients who came to me and kind of had some signs that opiate use disorder was going on. And we had a conversation about that. And since this person started treatment, he's gotten his life back, he's working, he's married, he's reestablishing relationships, he's doing very well, and he's truly a success story. But when he came to me, it really opened my eyes and my heart and compassion to individuals who have this condition, because it's very ubiquitous. People from all parts of the spectrum can have opiate use disorder, and that's why I want to talk about it today, because there may be people who are suffering who just don't know that something can be done about it. Now, who becomes opiate dependent? And then how can you tell that someone has it? Well, again, anyone can get opiate use disorder, but certain people are at a higher risk. For instance, males are at a higher risk of opiate use disorder. Those who suffer from anxiety or depression are at a higher risk of opiate use disorder. Those with a personal or family history of alcoholism or drug abuse, that increases their risk. Those who are younger than 30 years of age when they start using opiates are at a higher risk. And people who are prescribed or misuse opiates for a longer period of time increases the risk of having opiate use disorder. Again, having this does not mean you're a bad person. I've treated doctors, attorneys, college professors, students, the homeless, and other subgroups. And again, nobody is excluded from this condition. So how can you tell if someone you know has opiate use disorder or if you have it? Well, we talk about the 4 C's. C number 1 is cravings, which is having this really intense desire to use opiates. C number 2 is compulsive use, meaning that you can't not use it, so to speak, kind of like OCD. You see it and you can't help not touch it. It's just calling out to you. C number 3 is continued use. You're using it, you know it causes you problems where you want to kick yourself in the pants, but you do it anyway. And then C number 4 is loss of control, where you no longer have control of the opiate has control of you. Then there are behavioral and emotional signs. There's mood swings, irritability, anger, marital and relationship problems, social isolation, loss of friendships, missing school or work, or having poor performance at school or work, and then financial problems. And these can all, again, be signs that someone is dealing with opiate use disorder. Again, it's very common, it's treatable, and treatment works, and that's the good news. So if this information is helpful to you, whether you have opiate use disorder or not, or whether you know someone who might have it, or if you have learned something new, please type helpful in comments. That way we know that a message is getting out that can be encouraging to others. In addition, if you think that, please be sure to share this message as well on Facebook with others. And if you or someone you know does have opiate use disorder, we are here to help. I specialize in taking care of patients with opiate use disorder. I've been doing so for over 12 years, and we want to help you get your life back. Our telephone number is 614 442-2600. And we have a website specifically designed for patients with opiate use disorder. That website is www.midwestsuboxone, SUBOXONE, doctor.com. Treatment works. We're here to help. We've seen people who've been able to buy houses. They've graduated. They've gotten promotions. They get married. Just great successes as a result of treatment. And so think what getting control of your life could do for you. Thanks again for joining me this afternoon. I'll be back next Thursday at 12:30 Eastern Time to discuss obesity, and I look forward to seeing you then. Bye for now.